You know what else you can get?
What?
Chalk itch. So basically, when especially guys, when they're putting on their underwear, when guys are putting on their underwear, they're transferring from their toenails up into their groin area, and then you got a whole other mess going on.
Yeah, I'm not gonna lie. I don't miss the medical assisting days when you walk in and I love my old men, but not with their shoes and socks off because they take it off and their nails are growing every which way and it's straight yellow and you're
they take their sock off and they just pull their sock and you're like, please don't.
It's a crime scene.
It's gonna fling at me and then all the dust is gonna go everywhere.
Yeah, I need a mask. I feel like I'm gonna inhale the. I get anxious.
Yeah.
I'm like, put that thing back on.
Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skin Side
Out.
Welcome to Skin Side Out. I'm your host, Dr. Zain, with Heather and Courtney. So today we're talking all about nails from the inside out. So let's get right to it. Why are nails important in dermatology?
I think nails are really important because we don't really think about that as being part of our skin, but there's a lot of different anatomical things about a nail that make up a nail. And so it depends on if you're having nail issues, where on the nail, what does it look like? It could be, even though it's a small little area, it could be a number of things.
I'm always surprised when patients are asking me, wow, so you guys take care of nails as a dermatologist? I'm like, yeah, we are the experts in skin, hair, and nails. And it just baffles them. And it baffles me. They don't think that as part of your skin. So it is something that we evaluate, not only just the nails themselves, but they can give us signs of other systemic diseases. So certain connective tissue diseases can also give us insights into other pulmonary issues, things that are, up with our nutrition. So it is a very valuable tool when we're examining patients. So I find it very helpful. So let's get into the basics of nails. Let's talk about nail anatomy and what parts make up the nail unit.
So you have the nail plate. That's what's the hard piece sitting on top. Then you have the cuticle, which is kind of like at the base. You have the matrix underneath, which is really important. We won't go into full details of anatomy, but if you're going to have a biopsy of the nail, typically it's of the nail matrix. So we actually have to remove the nail plate, take the biopsy at the nail matrix underneath the nail, and then put the nail plate back.
And that's where the nail originates from. That's why it's so important.
There's also the nail bed, which is kind of the foundation of the nail itself. But the biggest thing that we see with nails is they're slow to grow, but they're slow to change also. So sometimes you can notice a spot on your nail that just kind of grows out on its own and then it's gone and you cut it off and there's no problems. But if it continues to linger, then that becomes a different issue.
Yeah. And fingernails and toenails have differences in the growth rate. Can you comment about the growth rate between the two?
The toenails typically grow slower. I don't know why though.
Further away from the heart. That's my
yeah.
Slower to heal, slower to grow.
Yeah.
Yeah, I'm not sure. But it does take about, I think, 3 times as long for the toenails to grow compared to the fingernails.
I know, and I think that's why a lot of patients sometimes get frustrated when they are treating the toenails. They feel like things are not working, but they just don't realize that it truly can take up to a year to see some of those true effects of the results.
Especially if we're treating some sort of fungal infection or anything, it definitely takes close to a year.
Yeah. And trauma does play a role in a lot of what we see in the dermatology office. A lot of patients come in with abnormalities of their nail, and just eliciting a history of some recent trauma can often explain many of the changes that we see. Like we see sometimes bleeding under the nail called a subungual hematoma. Sometimes we see some nail dystrophy. Oh, I dropped something on my foot, and that can lead to changes in the nail. All right, so let's talk about texture and growth disorders in nails. So, when we look at a healthy nail, it looks smooth, it grows in a uniform way. We typically see, we don't see pigment in it. So these are things that we normally see with, healthy nails. But when we start seeing changes in the texture, What does that give us information about? So let's talk about vertical ridges first. So Heather, what do you see with vertical ridges?
Vertical ridges are very, very common, and it's something that unfortunately comes with aging. So it could be just a normal part of your aging process, but it could also be attributed to dehydration. If you're not really getting your water intake, sometimes you can get that sort of like vertical ridging. And there's typically not much that we do about it unless it really bothers you. There are some like smoothing techniques that we can do.
Yeah. Let's talk about Beau's lines. So those are those horizontal lines that we see on the nails. And we have a photo of that we can show on the screen. So Courtney, these horizontal ridges are important because they signify certain aspects of our health. So what can it show?
It can show different signs of stress, illness. Sometimes in pregnancy, we see these exacerbated surgeries. So anything that kind of has that traumatic impact on your body, your nails can show it through the Beau's lines.
Yeah. I kind of see this sometimes in concert with like losing hair from like telogen effluvium too, because that's also stress-induced hair loss. So it's interesting when we talk about nails, I always also talk about the hair and see what's going on there.
Which also I think a lot of people don't expect a dermatology office to treat hair too.
Yeah. So pitting. So these are these small depressions in the nail, look like tiny little pits. And we see these in a variety of different conditions. Usually there's some type of, we see this often in inflammatory skin disorders. We see it often in psoriasis. Sometimes we do see it in severe atopic dermatitis or eczema. So that is also a clue. And we sometimes see it in other autoimmune conditions such as alopecia areata where we have, hair loss. So that's another sign that we can see. What about trachonychia?
So
What is trachonychia?
it kind of looks like nail pitting, but it's more like kind of looks like your nail has been sandpapered, or like you've taken a hammer to brass. It kind of has those like little indentations. We can see this with alopecia areata as well, but I think nail pitting is also common with alopecia areata.
Yeah. And then eczema, I also see it with Lichen planus sometimes also has those changes as well. Okay, what about onychogryphosis? One of my favorites.
The brown one.
Nasty.
So, onycholysis and onychogryphosis, these are thickened nails. And so you can either just have the thickened nail, which is onycholysis. I don't know if I'm pronouncing that right. But onychogryphosis, this bottom second one, it is where you get that thickening of the entire nail, but then it kind of looks like a ram's horn, and it has that kind of like curve to it.
Like a witch's fingernail.
Yeah. These are most common with aging, but also like if you're having pressure on your footwear or your shoes, it can definitely help kind of like thicken the nail in its entirety.
Yeah, these are pretty gnarly looking.
Yeah.
But it is a fun diagnosis and like explaining to the patient what's going on. They all think it's fungus.
Yeah.
It's not. So let's talk about something that we do see sometimes in our patients with, anxiety or OCD, habit-tic deformities on the nail. So, we do see patients who tend to tap or pick at their nails, at the nail folds, and it leads to deformity, especially in the middle of the nail. So that's a habit-tic deformity, also known as median canaliform dystrophy. And, it's traumatic changes to the nail, and unfortunately, most of the time, it's not reversible. So I always tell my patients with early signs to avoid doing that so you don't get permanent, dystrophy of your nail. But we do see it a lot. And a lot of people are just, tapping away, not even knowing that they're doing it. And they come in and they're like, oh, I don't know why this is happening to my nail. It's always been like that. I'm like, do you tap your nails? Do you, bite your nails? Those physical trauma can actually lead to these changes.
Do you have a way of determining whether it's the Habit-Tic or, because sometimes I feel like they look like Beau's lines, and I feel like they're also very different, especially if the patient's not aware that they're doing it.
Yeah, I mean, I feel like when I see these Habit-Tic deformities, it's definitely more centrally located. It's usually, surrounded by normal nail, like on the, outer edges. Whereas where I see Beau's line, it's more of a, horizontal line, and it's kind of throughout. I mean, it's unusual for someone to kind of traumatize the entire width of the nail. And I think that with a Habit-Tic deformity, you kind of see just like a focal area in the center. That's what I've seen clinically.
Is it usually too, like the Habit-Tic is more commonly on the thumbs, whereas the Beau's lines is usually most of the nails?
Yeah, I typically do see that.
Okay.
I used to be a nail biter. Bad habit.
Is that why you get your nails
That's
done?
why I get these pretty babies on. And it also helped me stop biting my nails because I take breaks, obviously, from my nails. But I read you can get pinworms because they sit underneath your nails. And so I went on a whole Reddit thread of people getting pinworms by biting their nails. And that stopped me. Like, I had been biting my nails for 21 years of my life. And then when I read that, I instantly...
New nightmare activated.
Yeah.
Yeah. Well, just don't bite your nails.
I don't. Yeah. And, babies, they often suck on their fingers, their thumbs, and they bite their nails. So my daughter, Miriam, she was a big nail biter, and we could not get her to stop. You know what stopped it?
Spray.
Nope.
Oh.
She got this horrific case of hand, foot, and mouth. Literally blisters all over her fingers. Her nails fell off, and that's what stopped it.
Yeah, I thought you were going to say spraying some sour spray or something.
Oh yeah, we tried that. It didn't work. Yeah, it was a really bad case of hand, foot, and mouth. But after that, never again.
Wow.
Blessing and a curse.
Yeah.
So let's talk about brittle and splitting nails. This is a common complaint we hear about regarding nails. So let's talk about onycholysis. What is that, Heather?
Onycholysis is where your nail is kind of lifting off of the nail bed. So up on the top, the fourth one, that's onycholysis. It's kind of hard to see, but you can notice that the top portion of the nail is lifted, so it kind of looks more yellow, and that's because it's not kind of stuck down anymore.
I had that happen to me in soccer.
Oh, really?
Many times on my toenails.
A lot of people also think this is fungus too. Yeah.
Yeah, I was in medical school. We were playing soccer, and my toenail was ready to fall off. And then all my fellow med students, they were saying, "Ew, you have fungus." I'm like, "No, it's not. It's from trauma." Sure.
Yeah.
So onycholysis, that's a fun one. So what is that?
It is peeling nails. I was trying to see if it is on. So on the bottom left, you can kind of see it's where that split happens, or the peeling of the nails. I feel like we don't see that one as common as we see some of the onycholysis. I feel like we see a lot of onycholysis.
Yeah. With the onycholysis, often they complain about these little nicks at the end of the nail. So, we typically see that these patients, whenever I grow out my nails, it just breaks in the same spot. So that's usually onycholysis. Onychorexis.
Onychorexis is kind of similar. So it's like a splitting or a cracking at the end of your nail. And we can see this with just brittle nails in general, but it can also be associated with Lichen planus. Lichen planus, I think, unfortunately, very commonly affects the nails, but in a lot of different ways. You could have reddish blue nails that are kind of swollen underneath. You could have all of your nails could just kind of fall off. It's called 20 nail syndrome. That could be a bunch of different things. But I think one of the skin conditions that we don't typically expect to affect the nail is Lichen planus.
Yeah. So there are physical agents that can also make nails brittle or cause them to split. So we're looking at water exposure. So prolonged water exposure, we definitely see that affecting nails. I see that in swimmers sometimes. Acetone and gel overuse. So in the nail salons, we definitely see that a lot. So we had to be careful about what you do to your nails because prolonged and repeated exposures to these can cause a lot of damage to the nails. Right, Courtney?
Right. No, we'll get into that later. How to keep your nails cute and healthy.
And in terms of thyroid disease, that's another common medical condition that affects the nails. And I do see a lot of brittle nails associated with hypothyroidism. And then people talk about supplements, how they can improve their nails with that. And, we hear a lot about biotin. So what are your thoughts on biotin for nails?
I think if you're going to take biotin, it's probably a little bit better for your nails than it is for your hair.
I agree. I feel like it does nothing for hair growth.
It causes acne, though.
But anecdotally, I've had patients say that, I think my nails are stronger. They're not breaking as much. So I do hear that feedback. Whereas I never hear anyone say like, oh, biotin helped me regrow my hair.
Yeah.
Okay, so let's go to nail color changes. So what's normal versus what's suspicious? So what are common color changes that we see in nails?
So yellow nails, we definitely see a lot. That, again, can be indicative of the onycholysis with the lifting or the nail fungus. That's a very classic sign of nail fungus. Smokers, we see that a lot, and all of that carcinogens from the actual smoke itself is coloring that nail. We see it with psoriasis. So I think yellow is probably one of the most common nail color changes we see.
Yeah, we see those oil staining appearance on the nails with psoriasis especially. White spots, similar to what we had talked about before with some of those, horizontal changes of the nail, they're often white. It's called leukonychia, meaning white nail. And many times it's due to trauma. So we see that a lot.
One on my thumb, but it's growing out.
All right. And then let's talk about pigment in nails, because I feel like this one is the one that causes the most concern in patients.
It's scariest. Everyone is nervous about, I think, having melanoma when you see that brown pigment, especially if you have not always had that pigment. But there are differences between pigment and what we see very commonly, the blood from trauma. So the hematomas where, someone maybe shut their finger in a door and it caused that blood stain, or sometimes even runners, that compression on the toenail can cause that. But the difference with that is that should be growing out and it shouldn't be getting bigger than what the actual size is, versus when you are looking for things like melanoma, your dermatologist might measure that, the length and the width of that line. You obviously don't want it to get larger.
Yeah. So Melanonychia is that term for like the brown streak. I think we have a good photo of that as well. But that is where you can be concerned for melanoma, but it can also be a normal variant. I think we do see that a lot, especially in our darker skin types. They tend to have multiple nails involved. And one of the biggest signs that we look for is called the Hutchinson sign, which is where you can have like pigment that goes past the cuticle. And that kind of gives us an idea that it might not be a benign form of longitudinal melanonychia and then further warrant a biopsy.
Yeah, so with benign melanonychia, very common in ethnic patients and skin of color. But we also see that happening with certain medications as well, and pregnancy with hormone changes too. So it all has to be taken into context as well, because you don't want to just go straight to a nail matrix biopsy. Believe me, it's not fun. I do them. It's not pretty. So we really want to get a good history. We want to know what's going on with their health, if they've noticed changes, if they've noticed it and their symptoms. Like, I have low threshold to biopsy, but if you have multiple nails affected, it's very unlikely that you have melanomas going on all your nails. And then also, like with pregnancy, recently pregnant, like changes, we do see those changes. So it always has to be taken in the context of a good history. And then along with Hutchinson sign, I think that's really important to distinguish, if it's under the cuticle or if it's going into the nail bed. That's really important because, benign nevus, I've seen Hutchinson sign with a benign mole, causing the melanonychia. So, It's not always 100% reliable.
Yeah. And the reason why it presents as a streak, even though it's a mole, is because the mole is underneath the nail. And so it's kind of growing out in that matrix with the nail. And so, like Courtney mentioned, yeah, we want to especially measure the width because we want to make sure it's not growing and involving more area of the nail itself.
Yeah. And I know that a lot of patients come in for routine monitoring of their Melanonychia. So I think measurements are like our best option along with photography and just kind of looking at those nuances with dermoscopy. All right, green nails. Pretty, huh?
This one's kind of common, green nail syndrome.
Paronychia. So what is that usually attributed to?
Pseudomonas, which is a bacteria. We see it a lot with people who often get their nails done. Courtney, have you ever had green nails?
No, because, and we'll get into this when we're going into do's and don'ts, but you find one place, you stick with them for 15 years, and you don't run into these problems that you go nail shopping around.
Yeah.
I've never, never, and I don't even need to knock on wood because that's how much I trust my girl.
So Pseudomonas, I think it creates this green pigment. There's a name for it, and
there's a nice, isn't it like grape odor? Doesn't Pseudomonas smell, but it smells kind of sweet.
Yeah, I think so.
And it likes water.
Yeah.
So that's where
you get water
lives.
trapped underneath.
Exactly. And then also like in sketchy nail places, like, who knows what they're changing now.
I've always heard like gardeners too, like if they don't wear gloves, and I don't know if it's like the water content in the soil or something like that, but I've heard that can be like a common place too.
Yeah.
If people aren't, I mean, that's where you get pinworms too. So I'd be wearing your gloves gardening.
Courtney has green nails.
I have a hole in my gloves, so I should probably change them.
Just in case.
All right, so let's talk about some more inflammatory and autoimmune nail conditions. So let's start off with psoriasis and how that presents.
I was going to say, if you wanted to skip these portions and go into nail infections, since we kind of touched
covered it.
Yeah.
Okay.
So maybe just go back and say, so let's go to nail infections.
All right, so let's go right into the most common chief complaint regarding nails, nail infections. So let's talk about fungal nail infections. So let's talk with Courtney.
Yeah, the fungus expert.
There's a fungus among us.
No, you know what? I do think I have fungus on my left big toe. It's been there for a really long time, and I just need to treat it. But
you don't want to get your liver function tested.
Yeah.
no, yeah. So nail fungus, it's so common, right? But majority of people, as we talked about kind of in our subderm episode, but fungus loves moistured environments. So, you think about places like water parks or the gym or things that are kind of that hot, sweaty environment. And, even couples can pass it in the shower. If you're, taking a shower and your spouse has fungus on their foot, and then you get that, you're not really clean.
Footsie.
They're playing footsies. You're getting that fungus, and that fungus on the foot can actually get into the nail. So, that's why it's so important to monitor that. But a lot of times people will start with the over the counter. So you have your, Lamisil, I can't even remember some of those over the counters because none of them ever worked. Tinactin, yeah. None of them ever really worked. That's why we see people in the office so frequently.
Yeah, there's a less than 10% success rate with these topicals. Like it is low.
Yeah.
And that's why nobody ever seems to get rid of it.
No, and I do think the orals do work so much better. So, there are oral medications like terbinafine and fluconazole that, your provider might check your liver. But they do, I think, a much better job. There are topicals that are prescription, some newer ones like you might have heard of Jublia, where it's a topical polish that you're putting on the toenail. But again, as we said earlier, your toenails do take almost a year to fully grow out. So patience is a virtue in this condition. You just have to keep treating, and hopefully as your nail grows out, you'll see that healthy nail coming through. But it's something you kind of have to stay on top of.
Yeah, you have to do it for like 48 weeks.
Mm-hmm.
Yeah, it's a long time. I mean, there are some home remedies that patients sometimes swear by, like the Vicks, vapor rub.
I think there's studies on the Vicks.
There are. It does work, but I mean, I don't think it's nearly as high of a success rate as the oral antifungals.
Yeah.
Some people do like the vinegar soaks. That can be helpful.
Heard Listerine. We'll use the brown one specifically.
The brown
Yeah.
Courtney's tried it.
No.
Success. And then there's some, patients who ask for laser treatments. So apparently the heat from certain lasers can help to, kill the fungus. And I'm sure it's a very painful and expensive process.
Yeah.
You had mentioned that, you can have it on the foot and it goes to the nail. I do have a lot of patients who seem to say, well, it's on my nail. Like, what would happen if I don't do anything? And it's definitely something where you can get like athlete's foot. So like tinea pedis can be related, and people tend to have both very commonly.
You know what else you can get?
What?
Chalk itch. So basically, especially guys, when they're putting
Yeah,
on their
we're
underwear, when guys are putting on their underwear, they're transferring from their toenails up into their groin area, and then you got a whole other mess going on.
Yeah, I'm not gonna lie. I don't miss the like medical assisting days when like you walk in and like I love my old men, but not with their shoes and socks off because they take it off and their nails are growing like every which way, and it's like straight yellow, and you're
they take their sock off and they just pull their sock, and you're like, please don't.
It's a crime
like,
scene.
It's gonna like fling at me, and then all the dust is gonna go everywhere.
Yeah, I need
all
like
the
a
dead
mask.
skin.
I feel like I'm gonna inhale the. I get anxious.
Yeah.
I'm like, put that thing back on.
Some of them just aren't very considerate with like how they take their sock off.
No.
They fling it off.
Yeah, and it's like poof.
I know. Well, and it makes me wonder, when's the last time you clipped your nails, which obviously it's been months, if not years. That is not your dermatologist's job. I would go see a podiatrist for. That's where we draw the line. Sometimes they're like doing a biopsy. So sometimes to test for the fungus, because it can be difficult to determine sometimes what's just dystrophy versus a fungus, but sometimes it's funny when we do the nail clipping and you can't even get the clippers
I had
to
that
clip.
yesterday. It was so thick.
So thick.
Yeah, so your podiatrist will be your best friend.
Yeah. They will clip them.
So let's go on to bacterial infections. So we talked about the Pseudomonas infection leading to the green nails. What else can we see?
Paronychia is very commonly bacterial. So paronychia is where you get this inflammation around the nail, and it can get very swollen, like on the side or at the base, red, painful. And I see this a lot for people who get their nails done, but I also see it for a lot of people who are on Accutane. And I think it just has to do with like that dryness aspect, and I think your nails are changing a little bit when you're on Accutane too. So typically it responds really well to antibiotics. Sometimes it has to be drained, but not super common.
Certain chemotherapy agents also can lead to paronychia. I've had a paronychia before, and it's like one of the worst things in the world.
It is
awful.
Yeah.
I'm sure.
It's very painful.
Throbs. It like has its own heartbeat.
And it has to like get drained at that point, and that's very painful. I remember when I think I was a new attending, I got one because I pick up my hangnails. I know I shouldn't. But yeah, I mean, I had one of my medical assistants and numb my finger. That was one of the worst. One of the worst experiences I ever had in my life. It was so painful because think about it, like nails and like the fingers are very sensitive. You have an infection, so it's not really that effective because it's acidic, and it was awful.
Yeah.
I think people who pick at their hangnails and cuticles are also like I noticed that as a trend, being susceptible to that. And it just, I think, creates that like opening and environment for the paronychia to set in.
Another common thing we see in the office are warts, right? And those are caused by viruses. So which virus specifically?
HPV. So there's a lot of different strains of HPV. Some of them more commonly cause genital warts. Some of them more commonly cause warts on the feet, more commonly some on the hands. But we do also see this, unfortunately, with a lot of people who get their nails done too. And unfortunately, I think a lot of people don't know that it's a wart and they think it's just like an overgrown cuticle or something like that. And then they're like traumatized to find out that it's likely from your nail salon.
I'd be traumatized.
Yeah.
And
they're so stubborn to treat. They're
They are.
very hard to get rid of.
They are.
Yeah. And sometimes they can get on the nail too.
Yeah. And they're pretty common, especially in the pediatric population. Kids have a ton of warts. They pass them to each other. So, we see a lot of pediatric patients, and it's sometimes very difficult to treat them because many of the treatment options are pretty painful.
Yeah.
So they don't tolerate it very well. So we do liquid nitrogen. We do some topicals that can help reduce the growth, topical immunostimulating agents. We have also some sensitizing agents. So a lot of different things that can be used to treat warts.
So should we get into the manicures, the pedicures?
All right, you guys take this from here.
You know what? Men should get manicures. So there are a lot of men get pedicures and manicures, but it is, I'm not gonna lie. There's a lot of nail salons out there. Not all of them have good practice. I've been very fortunate, but again, I'm a very loyal customer to my one woman. Like, it's me and her, and I've been going since I was 15.
Wow.
So yeah, there's the gel, the acrylics, there's the different kinds. I think, yes, you want to be aware of a salon that is definitely cleaning in between. So normally they'll have like the barbicide or Stericyde or something like that. If they're reusing any tools, obviously that's a red flag. If they're, not cleaning things in between. I don't think one is safer than the other, like a gel over acrylic. I mean, the acrylic, you're putting on a fake nail. And so technically that kind of acts as almost like a barrier between your nail and then whatever polish they're using. But again, you can get fungus or bacterial infections from a lot of things at the nail salon. The UV nail lamps, I know that's like a hot topic too. I always put on sunscreen before I get my nails done, so I don't have that problem. But I keep my little like sample size and I just pop it on my hands before they set, because they do set on the nail, and some of that can even cause that hardening around the nail and that trauma. So I recommend people taking breaks. Like, I'll normally have my nails done maybe for 3 to 6 months, and then I'll take them off for a couple months till they're fully grown out and fully healed before I put them back on. I think that's helpful.
And I think it's also important to check your nails while you're getting your nails redone, because you can have some sort of nail change like the Melanonychia and not know it if you're getting your nails done every single time and not paying attention.
Exactly.
Yeah, so public service announcement, when you're getting your skin check, make sure that your nail polish is off.
Yeah.
Don't have like acrylics or gels on. I want to be able to see your nail so I can properly assess it.
A lot of people apologize that their toes are not painted, and I'm like, trust me, I'd rather you have your toes not painted so I can see them. I think another big thing with manicures and pedicures is cuticle trimming. I think a lot of places over trim, and it can really traumatize that area and lead to more infections or just irritation.
Yeah.
Guys, the cuticle's there to protect the nail from infection, environmental irritants. It's there for a reason. You don't want to get rid of it because that makes you more prone to, these infections and irritations that can cause a lot of problems down the road.
Yeah, and you can gently push it back. You don't want to overdo it, but you also, some of that cuticle as it's growing out is dead skin too, so you want to get that off. I mean, you don't want to trim it, but you can like lightly kind of scrape it off. But that's something like you could easily do with just your other fingernail. Like I said, very, very gently. It's easier to do like after the shower when your skin is a little bit more malleable, but I wouldn't recommend cutting it.
Yeah, and that's one thing I've noticed with my salon is they never, like, I've seen that tool where they push the cuticle back with that like little metal tool, and ooh, that sends shivers up my spine.
Yeah.
Like, it looks painful, and I don't think it's needed really. I think sometimes they do that to try to get your nails to last as long as possible, like they're getting right to the bed. But I think that's also where some of that trauma can come into.
Yeah. So let's get into some fun rapid fire nail myths. So there are a few things that we commonly see patients, coming with these statements that they've heard on social media from other, information sources. So biotin fixes everything. True? False?
False. I wish it
False.
did.
Yeah, all right.
Be a cheap solution.
Yeah.
Nails need to breathe.
True.
I would say true.
Mm-hmm.
Yeah.
White nails equals calcium deficiency.
Some people say calcium or zinc. I don't know if it's like a guarantee.
I would say no because, well, are we talking the whole nail or are we talking, spotty?
Like the leukonychia?
Mhm. That could just be trauma.
Yeah.
I think if it's repetitive or like it's all the time and it's like all of your fingernails, then it might be worth checking, but
Fungus only lives in the locker room.
false.
False. Fungus lives in your bathroom thanks to your husband. Tell him to wash his feet in the shower. I feel like men do not do that.
Yeah.
just let the water rinse. They put soap and then they're like, okay, I'm good. No, wash your heels, wash your toes.
Do you wash your ears, your belly button, and your feet? I feel like those are the
my
three.
ears, yes, I definitely. My belly button, I'm not like getting in there,
Yeah.
Yeah.
I feel like a lot of people forget to. I don't really wash my ears.
Really? I do do a little low
I do it behind the ears.
Yeah, I do behind too. Just because I'm afraid my
not very
conditioner and stuff's going to build up there.
Yeah. I do my feet.
Yeah, my feet, I definitely do.
Yeah.
I go one leg at a time. I stand one-legged. But I feel like I don't know. Men, I feel like I hear sometimes they're like, oh, I put the soap on my body and it just
It gets
it runs down. I'm like, no, that's not washing. That's not the same thing.
dark polish ruins nails.
I haven't heard that one.
I don't think it ruins, but I think it can stain.
Yeah.
I've
Sting or stain?
stain.
Yeah.
I've definitely had my nails stained before.
Yeah.
So.
I think any nail polish can, damage the nail.
Mm-hmm.
So dark or light.
True.
Yeah. All right. So let's wrap up this episode on nails. So when do you need to see a dermatologist for a nail condition? So I think the biggest one that we see is, a change, especially in a pigmented streak in the nail. I do think that that's worth investigating because, the consequences are pretty dire if it is melanoma. So if you notice any changes like that, definitely call your dermatologist and we'll be happy to see you. If you notice any symptoms like pain, bleeding, lifting, pigment changes, I think that definitely warrants an examination. Nail changes lasting over 6 months. And it does pay to actually get your nails examined because it can be a sign of other systemic issues going on and other issues that may be at play. So I do think that it is important to get your nails evaluated, make sure that your nail polish is off, your gels are off, and so that we can kind of take a good look at it. So any other tips, tricks for nails?
Dermanail. You have weakened nails. I love Dermanail. It's over the counter. Like a little polish you put on, it just helps strengthen them.
Yeah, I do recommend that a lot.
Yeah.
Well, I think we nailed it. Until next time, skin side out.
Thanks for listening. This episode of Skin Side Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.